This is Dr. Dan Purser, danpursermd.com. Tonight's the big Facebook Live we've been planning for months. Mike Clark and I recorded a video. He flew up from Austin, Dr. Mike Clark. You need to watch that video if you haven't. It's on my website, danpursermd.com. Make sure you watch that and the two preparatory videos that go along with it. They're both really short because that's really about what we're kind of going to talk about tonight. And we really dive deep in that video, so please watch it if you haven't. Tonight, this is called Learn How Genetics. We changed the name like 12 times, so I'm just going to read it. Learn How Genetic Errors May Affect Your Child. That's what we're going to teach you, how they may affect you, how they may affect your husband, how they may affect your mom, a lot of people. So genetic errors are what we're fundamentally made up of. It's the map for how our body comes out. So let me cover some other stuff really quick. I want to show you, so everyone's been asking, this is that Pro 7 genetics kit we do. It's super easy. You'll get this beautiful box. It's the Dan Purser Pro 7 55 SNP genetic kit. There's both a child version and an adult version. Child would be under 18. And if your husband acts like a child, probably might want to do that one on him. So you take out the swab, it'll have your name and everything printed on here, and the date of her birth and stuff for your birth. Then you open it up, you set your watch or clock or something, your egg timer, and do 60 seconds, swirl it on this side, inside your cheek, on the inside of your cheek, and then switch to this side after 60 seconds. So you're going to spend 2 minutes doing a total of both sides. Then you carefully put it back in, put it back in the foil, put it in the paperwork, which is already filled out, probably already in the box. This is your mailer. Comes with it. And this shows 55 SNPs that we can treat. You put it all back in here, seal it up, tape it, and mail it. You have 3 weeks to mail it once it's been done. Please mail it pretty quick. We'll get the results back 10 days after it gets to Austin. So a lot of this has to do with Kendall Stewart's work in Texas. Dr. Kendall Stewart's an amazing man. Mike Clark's work too. So also tonight or today, don't forget my book, The 85% Solution, which was #1 for 2 years in the medical genetics section on Amazon, is back up. I think it was #1 a few minutes ago when I looked at it. You can download it for almost free. We laugh because my vitamin book we had for free, and that kind of got shut down and still shut down. So we had to do this one for 99 cents. Welcome to the new Amazon. Okay, so anyway, 99 cents. Sorry you have to pay anything for it, but I think it's worth millions myself. But download it on Kindle tonight. Please leave a review. You don't have to. That's kind of one of the optional things for to be enrolled for the giveaways. There's some amazing giveaways tonight. We'll get into those further in a minute. But so to be eligible for the giveaways, I've got a list. You got to download my book. That's optional though. My almost free book, and the 85% Solution. Scan it real quick. Leave a review. Watch the 3 genetics videos, and post a question. I'll try and get to them tonight, or to late tonight, or tomorrow, or the next day. By Sunday, I'll be so brain fried from answering 8 bazillion questions, but keep asking, and I'll answer them. Sometimes I don't have any better answer than we should check their genetics. This is, I remember back when I sent patients up to Huntsman Cancer Institute for $30,000, they could get their genetics testing. We're talking about less than $500 to get the Pro 7 kit done. And it gives a lot more detailed information than we got off the $30,000 testing we used to do at Huntsman 15 years ago. It's very private. No one will know your business, just you and I. It's not like 23andMe where everyone can figure it out, and it'll be on Google eventually. So some giveaways tonight. We're going to give away some more master formulas, some more Super Bees. I even have an Adhd I'm going to give away. An Adhd. Yeah, that'll be fun. And a Theroman. Matter of fact, I'll give someone both these Theromans. This is an old school Theroman. I've had it for a while. I haven't opened it or used it. This is a brand new Theroman. So give those away. This is our Mthfr support. Going to give away some of those, like 3 bottles of those. Well, maybe 4, because I'll explain the fourth one. The Mthfr support plus. This is the milder form with folinic acid. Really critical that you know about these. We did design these based on 800 Spectre cell results we had on. Well, I call them virgin patients with MTHFR. These are people who weren't taking any vitamins that had MTHFR, so we could tell what their deficiencies were. And we used the top 8 deficiencies they had and put them in the supplement. And it works really well. Also, some of our VARs, glutathione, that we just got a major patent on. This is going to be FDA in a few years. It might be really hard to get it now. I'm just warning you. Also, you guys know, some of you know the rumor. It's probably true, but we'll find out later. Something else that you've all been waiting for. This is a Tiny Bite. We call it Tiny Bite because it's chewable. It tastes incredibly good for something packed with B vitamins. It's half the dose of the MTHFR Support Plus, and you can cut them in half again. They'll be scored. They'll be cross-scored, meaning you can cut them in fourths. So it becomes 1/8 of the dose of the MTHFR Support Plus for little kids. I take half of one every day anyway because all I have is A1298C, one of them. So it works really well for me. This is it as a fourth. It is a little crumbly. Hey, it tastes darn good. That'll be out in the next few weeks. It's similar type bottle. There's no label on this. I apologize. We thought we'd have a label tonight. We do not. Also, I'm going to give this away. These are B12 pure encapsulations, B12 liquid drops for some lucky parent to give their child. So it's a really good way to get B12 in, just giving you the ideas, giving you the hint that some of you may want to do it. And again, don't forget our VARS glutathione. It's the only functional, validated, thus we call it VARS, validated, absorbable, reduced stable, patented glutathione in the market today. And we're getting an FDA approved for several conditions, so we can get an FDA OTC approval. So it's amazing stuff. It really does work with the money back in it. It's probably the best. Well, it is absolutely the best glutathione, the only functional one on the planet. And I'll debate with anyone on that. Watch for my big TED Talk I'm going to do on super antioxidants, because we also think we figured out SOD, so which is pretty amazing. And the FDA approvals, we'll get on that one. So SOD and glutathione. I need to do a TED Talk, and I'm going to. So, okay, on to the main event. I showed you the Tiny Bites. Oh, yeah, the main prize tonight, the main giveaway, is someone's going to win an autographed copy of my 85% Solution hardback. And that's not the main prize. That's like the second most main prize. Someone else will win an autographed copy. They'll win a 30-minute consult with me, and we'll test them for free with a Pro 7 kit. So they get one free visit to go over the results. The kit's free for them, and it's a prize worth $700, $800 total. And they get an autographed copy, which is infinitely valuable, I might add, because everyone wants these, right? I mean, Brecken, do you want one of these?
Oh, everyone.
That's my daughter / stepdaughter. She and I won't even give her a copy. She hasn't won one yet. She's been trying.
He won't give me anything.
Yep, 0. I gave her kind of a job, but we'll see if she sticks out with it. Okay, so anyway, there's the 85% Solution.
People are loving that prize. They're really excited. I think everyone just wants to talk to you. Okay,
well, you're going to get to talk to me tonight. So we know how to do the GX or the Pro 7 kit. So I say, let's get to the questions. You guys want to ask me questions? This is what you're here for. Make sure you watch the video. It shows what causes inflammation in little kids, little babies. In the video, Dr. Mike Clark and I flew up from Austin. He and I talk about a 1-year-old and a newborn and the genetic testing we did on them and what we saw and what we found. We both discussed it in detail. Please watch that video. It's earth-shattering. It'll kind of hopefully it'll be a viral sensation. It should be. we put a lot of hard work and planning into that video, and it's free. It shows what causes inflammation. It shows what causes ADHD. It shows what how they can't fight off viral infections, how they can't properly accept immunizations without causing massive inflammation. So it needs to be maybe considered to be done when they're a little older, like 3 or 4 or 5, and individualize the vaccinations, immunizations, separate them out. For those kids, I think it's really special that be considered. Though I have seen some other parents in my office who have stuff like that going on. It's shocking when I see adults with it, and they've had lifetime inflammation issues. They hurt all over, their muscles hurt. They don't know why. It's not fibromyalgia. It's kind of a weird inflammation. I know some of you already asked me about that. And so I say if your 12-year-old or 9-year-old or 8-year-old or 10-year-old has a lot of pain and inflammation in their legs and soreness, get that Pro 7 55 SNP kit off my website. You just go to my website, danpursermd.com, look for testing, and order it. I showed you how to do it. You just swab the inside of their cheeks and stick it in the mail, and then set up some time we can talk. Or after you watch the Mike Clark and myself video, and those 3 videos, you might be able to just handle it yourself. I'm trying to educate you enough so you can do that. And you can read my book, We're All 99 Cents, or some of you already have a copy. Apparently a lot of you already have a copy. So we'll have to talk to the lucky person, see if they want us to do a video of me going through we can block their name and stuff, of their winning 55 SNP Pro 7 kit, and what my suggestions are for them. So, or their child's, or whoever they want me to do. So why don't you guys, Brecken, why don't you start hitting me with questions? Okay. Let's see what we can do.
So the very first question I saw was, how does this Pro 7 kit compare to 23andMe?
23andMe has privacy issues. It's the wife of the founder of Google. That's the first thing I always have to warn everybody about. Use a different name. Don't do it, whatever, if you're concerned about privacy. The Pro 7 is a lot more targeted, and shows me 55 genetic errors that we can do something about. While 23andMe is just everything. It just doesn't really differentiate between things we can treat and things we can't. So it'll show me inflammatory genes that we can do something about. It'll show me MTHFR genes that we can, and methylation genes that we can definitely do something about. It shows me genes that cause anxiety. Probably the number one thing I see in kids and young adults and young people and sometimes middle-aged adults is bad anxiety, horrible anxiety. And it's almost always genetic. I don't know anything ungenetic that could cause it, non-genetic that could cause it. But it's so, it shows me really targeted genetics that we can actually treat, that we can do something about, not just this huge hodgepodge of stuff. 23andMe, you have to get it compiled anyway with NutriHacker, as a lot of you know, or Promethease from Stanford, and then it allows more privacy issue problems. But the reality is that we can do stuff with the 23andMe, just not as targeted as with the Pro 7. That's all. So, and it comes back in 10 days, not 10 weeks. So if you really want to know or want to help that 12-year-old or 10-year-old grandson or granddaughter or your daughter before school starts, and you don't want to do the test and wait till August to get the result, do it now. You can do the Pro 7. So, next question.
What are the first signs of genetic errors in children that you recognize or that parents can recognize?
Wow. Well, you can start really early with little babies that won't look you in the eye, that seem distracted, that never make contact, that aren't very loving or hugging or kind, because they're having a lot of inflammation. They're maybe on the spectrum, the ASD spectrum, and you got to worry about them. You all the signs and symptoms that they might be becoming autistic. So that's the earliest signs. I tend to think anxiety, ADHD, inability to turn their brains off at night and sleep. I know kids get excited, and I don't believe in drugging them up, but it's usually because they're lacking B vitamins, certain key B vitamins. Hey, I'm the guy who helped reformulate Super B into what it is now. And remember, I had a lot of input with our SpectraCell results and stuff into master formula. So, and those all have methylated B vitamins in it for people that have methylation issues. It's because we recognize that then. So that's why I'm always suggesting Super B for people to try. So if you're a Young Living distributor, give it a try if you think you have MTHFR or some other methylation error. It can be really helpful. And you try 1, 2, or 3, or 4 a day. Keep pushing it up until you overmethylate. Same with the MTHFR support. Same with the MTHFR support plus. You take it until you overmethylate. So the overmethylation usually means you get really sleepy, like you took 2 Dramamine or 3 or 4 Dramamine that morning, and you just want to sleep off and on all day long. That's overmethylation. Okay, next question. I don't know if I really answered that well. I think I have ADHD. Probably.
Yeah, he does. Is it important to avoid foods with folic acid if you have MTHFR?
Yes. Yeah, and prenatals with folic acid and cyanocobalamin, which are most of them, they will make you sick. The other thing that women cannot take if they have bad MTHFR, they can't take birth control pills. It makes them crazy. They'll tell you that pill made me crazy. I thought I was going to go crazy taking it. And I took it 2 weeks and I couldn't take it any longer. Or I took it 3 months and it made me completely crazy the whole time. I wanted to kill myself. I wanted to jump off a cliff. I wanted to do something. I'm like, did you stop it? Yeah, when their parents let them or whatever, or they told their parents they were taking it and they quit taking it. But because the doctors are giving it out for PMS, are you kidding me? And other issues. The other problem with birth control pills, especially in younger girls prior to age 18, you get a 500+% lifetime risk of death, not lifetime risk of death from breast cancer if you take it prior to age 18. That's a huge differential. That's a huge red flag. And there's all kinds of studies now out of Northern Europe that show that. Not that they're really allowed to be discussed here in the U.S. I may get bleeped here on Facebook for saying that. So, sorry. Okay, I didn't say that. Forget I said that.
Oh, we'll try and rewind. Joking. I know you talked about anxiety just a little bit ago, but in specific, are there any genetic errors that are usually causing this anxiety, and is there anything that you can do about it?
Yeah, there's a lot. GAD1 is the big bad ugly. GAD1 and GAD2 errors. Because GAD1 and GAD2 errors, you make GABA. GABA, gamma-aminobutyric acid, it relaxes humans. It's our brain Valium. It's our brain Xanax we make internally. And matter of fact, it's the GABA receptor, which is also called the benzodiazepine receptor or the Valium receptor. And so GABA hits the benzodiazepine receptor. Well, so does Valium. So does Xanax. So do all the others. They hit the GABA receptor. So, but they get on it and hang on to it. So your whole goal, your brain's whole goal is to balance GABA with something called glutamate. And glutamate is what you make GABA from. So you convert glutamate to GABA. And if you have a GAD1 or GAD2 genetic error, you or your child or your grandchild or your cousin or your brother or whoever won't reduce the glutamate and make GABA. So glutamate is excitatory. It causes anxiety. So you need to make sure you have low glutamate, high GABA if you want to be mellow, relaxed, all that. And your brain's constantly doing this balancing act, unless you have GAD1 or GAD2 errors. You treat GAD1 or GAD2 errors, as you can see in that, I think that we discussed it in the Mike Clark and me video, the children's genetics video, that you treat GAD1 actually with, you can do some antioxidants and some other stuff, fish oil, things like that. But mainly, if it's really severe, you use Mantidine, oddly enough, which is actually a Parkinsonian drug. Fairly side effect free at the tiny doses you use, but it blocks the NMDA receptor, which is how you create glutamate. So you actually make less glutamate. And that's how people get rid of their anxiety, start functioning better. There are other things you can do for it. There are other genetic errors like ATG 12L1, ATG 16101, stuff like that on that Pro 7. And that shows you things that can cause bad anxiety, like DCI, dechiral inositol, which is crazy good stuff. It's a mirror image of regular inositol. That goes in and can really help with anxiety. Or lithium carbonate, which is just lithium orotate, not carbonate. Lithium carbonate's a drug. Lithium orotate is just a vitamin, just a supplement. 5 milligrams or 10 milligrams can really, really help with anxiety. If you don't want to go through all the genetic testing, if you don't want to try all this, try at least something like that and see. But then if you got kids with the problem, you'll want to really know what's going on. Does that help?
Yeah, that's great. Kind of on the same topic, can pain be caused by genetic errors?
Yeah, well, I mean, not gunshot pain, or not your broken arm pain, or not football pain, or car wreck pain, or stuff like that. But a lot of inflammation. You can get chronic inflammatory conditions right and left. And we do several whole pages of testing in that Pro 755 SNP testing panel we do, looking at inflammatory conditions that we can alter, and inflammatory genetic errors that we can alter. There's neuroinflammatory, there's total body inflammatory issues where your muscles ache, your joints ache, your hands ache. They've been aching all your life. You don't know different. You've never had them not hurt. And but especially if you get certain medications given to you, like vaccines and stuff like that, they can cause massive amounts of inflammation or neuroinflammation, stuff like that. It can become a real problem. So you want to reduce that inflammation, especially in younger kids, little kids, babies, stuff like that, because it can really help. But it can cause you migraines, it can cause you headaches, it can do all kinds of bad things to you. So cancer risk, everything else. Inflammation is the big bad ugly. Okay.
Interesting. So someone's son is really skinny, and they've tested him, and he has low testosterone. He has anxiety. Could that be genetic?
Yeah, probably it's all genetic. Everything. I see that a lot. And a lot of the young men that come in, they're like 25 or 28 or 19 or 30, and they have super low testosterone. They're back to the GAD1, ATG problems, stuff like that. A lot of inflammatory conditions. I tend to, there's almost no way to bring up their testosterone, so I might give them a compounded testosterone cream, which can really help them relax, get rid of some of their anxiety. But you got to attack the GAD1 stuff very aggressively, and you need to really help them. These people are suffering. They have anxiety all the time. They cannot turn their brains off at night. Their sleep is all messed up. I'm sure everyone listening to me knows someone like that. And they're the ones that tend to show up in my office, and I love helping them. For a lot of personal reasons, I love helping those people. So women or men.
Had a really interesting question.
I'm going to get a drink. I don't mind.
Okay, go ahead. So someone is nursing, and they have Mthfr, and they're taking Mthfr, and they're wondering if that can make their baby overmethylate. Have you ever heard of anything like that?
It won't pass through. It won't pass through the milk.
It's interesting. Next question. This person doesn't have Mthfr, but they're taking your Sport Plus, and it's really helping. Do you know why it would?
Yeah, because there's a lot of other methylation errors. There's MTHFD1, there's MTHFS, there's TCN, there's just a ton of them. There can be a number of them that they can cause methylation errors. So MTHFR is just kind of the worst one, but there's others that are almost as bad. And that's why people are like, I don't have MTHFR. You can't help me with my depression and anxiety and fatigue. I'm like, well, yeah, there's like 12 other methylation errors you could have. Do you have those? Again, that's what we look for on the Pro 7. Those other methylation errors, because guess what? We can treat them.
So you just listed a couple different symptoms. What would you say is the number one symptom you see when it comes to genetic problems?
Fatigue.
And how come?
Because of genetic errors, they can't properly absorb at a cellular level a lot of B vitamins, amino acids, minerals, things like that, unless they're very properly designed to go around the error. And you got to get really personal about some of those errors in the supplements as they're designed. But we think we've done a good job with that. And they just need a lot of the assistance. I mean, it's surprising. For example, our Mthfr support has, if you take one of them has almost 21,000% of the RDA of vitamin B12 in one of the Mthfr Plus support capsules. Same with the Support Plus. That's 21,000. And I have patients who take 9 of these a day. Then they feel normal. I've had patients take 15. I have a lot of patients that take 4 or 5. So they're essentially getting 100,000% of the normal RDA. And people go, I'm taking 1,000 microgram B12 shot. Why aren't I better? I'm like, well, number one, it's a lot more multidimensional. See the back of this? And you can find out. These are both on Amazon Prime, by the way. And so is this back up again now. So you're not even close to taking enough stuff to fill those holes. I see them as wells that we're constantly filling with B vitamins, and you need to really fill them. And babies need them too. Thus, our Tiny Vite, which is really good, and you can mash it up, put it in their oatmeal, put it in something so they can get it, even if it's 2 or 3 times a week. And it could help them a lot too. If you and your husband both are homozygous, or you've tested the baby, you swab their mouth and know, there's a lot you can do. Helps optimize their height growth, helps optimize their hormones, helps maximize everything for them. Much better development and everything else. Thus, if you want to do all that, get the testing. We can figure it out. And so watch the Mike Clark video that he and I did. So on genetics, helping your baby.
Is there any genetics that specifically can pertain to women more that you've noticed, or like a symptom that most women have? Yeah, maybe I haven't definitely proven this yet, but compound heterozygous MTHFR and ATG errors, I think they have PCOS. I think that might be the combination that causes PCOS. I could be wrong. But they do really well on D-chiroinositol, really big doses of it. And so DCI or D-chiroinositol is really the mirror image of regular inositol, which is a B vitamin. I can't remember which one. I want to say B8, or B9 or something. But it helps with hair growth and a lot of other things. It also helps with insulin sensitivity and can really help with PCOS. So we're going to cover that in our PCOS and Facebook Live we do later this summer. Remember, our next one's on endometriosis and PMS on the 29th. So you got 3 weeks, people. Get ready. Okay. Kind of going back to the last explanation you had just before, talking about the holes that need to get filled. Do those ever get filled to the top, or is it a constant, you're going to have to take these supplements for the rest of your life? Sorry,
I can't fix your genetic errors. We haven't figured that out yet. You're going to have to take them the rest of your life. They're always going to dribble down. Your holes, they're wells. That's why I think they're wells that are constantly being drained. You just got to fill them back up as best you can and keep them as close to the top as you can. If they overflow, you're going to overmethylate. So you don't want to do that. So you never will feel 100%, but you definitely don't feel it way now. You feel so much better, you'll forget how bad you used to feel. Yeah, and I will warn everyone, if you start on this and you feel amazing and your life really, really improves and you decide to quit taking it, good luck. Because you're going to have some really bad days because you're going to realize how bad you used to feel all the time. So it's just the way it is. I never intended for it to have that kind of reaction when people quit it, but it's pretty awesome.
Yeah. Going back to genetic testing.
You bet.
Someone's asking if all newborns should be tested or if it's only specific ones that are having symptoms, or what do you recommend?
I don't know. You'd have symptoms in a newborn. I'd say test them all. That's just my opinion. Well, yeah, of course I'd say that, but I don't know how you're going to know. And so I would want to know before I let my baby get the 9 vaccinations in that one day. They're so incredible. I want to know if maybe I should space them out. If maybe they're going to have inflammatory issues, then I might want to wait another few months for them to mature more, stuff like that. Or how do I deal with the inflammation they get? I don't want to give them Tylenol, which is what they suggest, or ibuprofen or something like that. What should I do? Are there better options? Watch the baby genetics video that my Clark and I shot. You're going to learn a lot from that. It's going to be an hour well spent if you're a parent.
That's great. Also on the same guidelines, we had someone who was wondering if there's any age you shouldn't get genetic testing where it doesn't really matter.
103, 98, 79, so whatever. You decide if you didn't care anymore and you're just on autopilot. So, but sometimes it wouldn't hurt to get it so your grandkids will know what you had. Get a 23andMe and get a NutriHacker so your grandkids will have that in record. Or get the 55, the Pro 755 SNP kit. Get something so your kids and their grandkids will know and be able to look back and go, Grandpa had this or Grandma had that. But yeah, no, I think kids are where I'd aim this at. I'd really be looking at kids because that's the number one complaint I get. My child is autistic. They asked me to run the state training school here in Utah because there's such a wall of autistic kids coming towards the 22-year age limit that parents can't handle them anymore, and they end up at the training school here. And I refused. I turned that down because of issues with they wouldn't let me do all the vitamins and supplement support that I'd want to do, which is the best way to treat all these conditions.
So along with that, why do you think autism is caused by genetic errors, and how does that work?
That's a great question. I think it's exactly what happens. That's what Mike Clark thought too. But you have, especially if you have IL-5 or IL-13 or CD14, watch the video again on my homepage, my danpurchermd.com page. Like IL-5, for example, their basophils and their eosinophils will not mature. They also, I give a quote from a PubMed article that they can't properly respond to vaccinations with an IL-5 homozygous error. IL-13 is the same. CD14, they can't turn off the inflammation. So let me back up. When you can't handle the vaccination or the viral particles or whatever, then you get bad inflammation, and it can go on. That child can go on for months or years, especially if they have certain genetic errors like CD14 or STAT4 or any of those. That's an on-off switch. They can't turn their inflammation off. They can. And so they just sit there inflamed, and it affects their neurology, it affects their brain, it affects a lot of it. And that's the last thing you want to do as a parent. And so it is the genetics that cause the problem. It's not the whatever might be in the vaccine or the shot or medicine or whatever they take. It's not the aluminum. There is no more of that in there anymore. It's the inflammatory response that occurs in the child's genetics that causes the problem. Sorry if you want to hang me. That's what all of us who are in genetic medicine are looking at, all that stuff. Mike Clark talks about it. We all talk about it. Watch the video.
Interesting. Along with that, we had someone who asked, why do they get migraines every time they get vaccinated for months afterwards?
Same inflammatory. That even as an adult, they still have genetic errors, of course. IL-5, IL-13, IL-6, one of those. I'm saying IL, that's interleukin 5. So you can't mature your B cells or your eosinophils. Some of them you can't, like, I'm trying to remember offhand which ones they are, but some of them you can't mature your T cells properly. Well, if you can't mature your B cells or your eosinophils, you can't respond to a vaccine. All you get is massive inflammation, and if you can't turn it off, it's just going to affect you for months and months and months. So, and every time you get a bad virus, you probably feel terrible for weeks after. While most people recover really quickly. Something you could do is use a really good quality glutathione to help reduce the inflammation. That can help a lot. But there's a lot of other tricks to doing that. You need to deal with your methylation support issues too. These are the kind of things, watch the video and watch what we say, but these are the kind of things we do. And people feel normal. Do they feel all the way normal? Well, they feel the best they've ever felt. I don't think I can get anyone feeling perfect. You can't do it. We don't know enough yet about genetics. We're still too early on to know a lot about the genetic issues. We're still learning. We're barely 10 years into this as really a medical theory practice. So.
Interesting. Another question. Can you tell in advance if someone is going to get a lot of inflammation from an antiviral vaccine?
Yes. But genetically. That's what I'm saying. If you wonder, or if you've seen it, or you had a child who you believe became autistic, get the genetic testing, find out what's going on with your newborn, or find out what's going on with that autistic child. See if they got massive inflammation. Guaranteed they probably do. So, and you can deal with it. You can help them. Can you reverse it? I've seen several cases of kids with autism who become basically essentially normal. They start asking where their parents are. They start hugging everyone. Just it's a really noticeable change, and it's mainly because they're missing something genetically, and you give that to them, they get dramatically better.
It's interesting too. Next question. Someone else was asking, why is my little baby so sensitive to touch? I try to rub his back and he seems to hate it. Is that anything to worry about?
They can definitely get increased sense of pain. That can be genetic errors causing increased pain sensitivity. You should be. Yeah, it's also a sign of maybe possibly impending being on the spectrum. So that's the way one of my children were, and that person's on the spectrum. So they were that way when they were little kids, a child.
So this is kind of multiple, but can one child have autism and one not? So for example...
In the same family?
Yeah, in the same family. Because for example, one from the vaccine had no reaction, and the other kind of just seemed to suffer from it in a way. Is that... I don't know. It's an interesting question. It was like they have one son who has no pain from vaccines, and the other seems to suffer immensely.
Yeah, because the other one probably has the inflammatory. They can't handle the vaccine properly because they've got inflammatory genetic issues.
So genetics can be different for each kid?
Absolutely, they can, even though you're from the same parents. I've seen that in my 5 kids with my first marriage.
This is kind of a funny question. Can genetics be the cause to my husband's hair loss?
Yeah, he's male. It's male. Women, it's not genetic ever. Don't ever let anyone tell you that. Even if some doctor misguidedly tells you that, it's almost always a vitamin deficiency. But for men, it's almost always male pattern baldness. You can do a lot about it now, and I'm not talking about hair transplants. That's hideous, but you can do a lot of really good things for it. You can recover most guys' hair. Maybe except for mine, but most guys' hair more than 100% even. I know that sounds crazy, but it's very doable. We do it all the time.
Will glutathione help my 20-year-old daughter with autism?
I don't know.
No?
I don't have any way to know that because I don't know what her genetics are. A lot of people can't mount a lot of glutathione. They can't make it. And they have genetic issues where they can't properly reduce it. And so they'll never detox properly. You can give them support, you can do whatever you want, other than giving them a glutathione that's been patented or FDA approved or whatever. That's your only option.
Can genetics be related to allergies? To like outside?
Yes. Yeah, all the time. Histamine responses, things like that, are definitely tied to genetics. Also, if you eat high histamine foods, it can cause you to feel like you have urticaria all the time from food and stuff, hives and things like that. So very much, and you can figure that out too. We look for that. Plus, we do some really advanced allergy testing on food too.
So I've had a couple questions now asking their children or grandchildren have been vaccinated, and they have changed a little bit after that time. Should they still be tested genetically, or do you think it's
more so? Oh yeah, heck yeah, and yes, yeah, and that way can kind of guide you how to manage the vaccinations in the future. And I'm not saying not doing it. I'm very libertarian. I don't care what parents choose to do it. It's not my place to interject. But as a physician, I think everyone should be vaccinated. But some you got to be super careful with and do it at their own time, their own space, their own speed, their own rate when they get old enough, things like that. So occasionally I read about kids who are 15 finally going in and getting vaccinated. That's that parent's choice. And maybe they had genetic testing from their pediatrician. Probably not, because this stuff's just becoming available. So, but I definitely, if you had this testing, take it to your pediatrician and show it to them. And that way you get an explanation. You can explain why you don't want to do it this way or do it that way and how you're going to control it. And you're allowed to do that. I don't know. Well, I don't know. California, I think, is getting rid of all the libertarian concepts of parenting, but I know in Utah they won't say a word if you don't vaccinate. So
another question. So their son seems to react opposite to medications. So Benadryl makes him hyper. Ritalin made him angry. Does this have anything to do with MTHFR, genetics?
Yeah, probably a lot. I don't know how old the son is. I don't know what his genetic issues are, but I'd say yes to all of it. Yeah, I'd get him genetically tested and figure out what's going on. So it's so cheap. Why not? And no, good luck getting insurance to pay for it. They tell you they should do it. They'll only do stuff that they approve, even though all this stuff is beyond a shadow of a doubt been proven by NIH and everyone else. But they just, they have their own thing they'll allow. So, but I'd get this genetic testing figured out, or some kind of genetic testing, and figure it out. It's gotten so cheap.
So what was the cost of it a couple years ago?
Wow, it used to be $8,000. I remember when Huntsman came down from $30,000 to $8,000. It was great. I sent several patients up to have it tested. They could put that on a credit card. They wouldn't need a home loan. And then after that, it kind of disappeared. I think it went into the $2,000 or $1,000 range for a while. Now it's gotten into the hundreds. The good thing about the Pro 755 SNP kit is that we can get GX Science to look at the results too and get one of their genetic counselors to go over it with us too if we have questions or if you have questions. But I can call them and talk to them. And sometimes I'll link you guys in to it so you can listen.
That's great. So this person's husband has depression, PTSD, anxiety, sleep apnea, and his brain just won't shut down. What do you think would help? I
think I already described all that today. I'd get him tested genetically. And yeah, maybe it's testosterone, so maybe other stuff, but maybe it's caused from his genetics. That's what I tend to look at. That's kind of what got me into this. Kept seeing young guys with low testosterone levels, and I could not figure out what was going on. So then I did SpectraCells on them. They always showed B12, pentothenate, folate, serine, glutamine, just all kinds of weird glutathione deficiencies, stuff like that. And that's MTHFR until proven otherwise. And I didn't know that back then. So they had low testosterone, they had all these weird vitamin deficiencies, and they had bad anxiety and depression and insomnia. And now they have none of that. And you just once you figure out your genetic issues and get on the program, or you get your kid on the program, or your child on the program, or your baby on the program, you kind of grow it up with them. And it helps them immensely, helps them optimize their life experience, helps them optimize their grades, their schooling, and they just become better, more mature adults. And I know when we started Chantel, when she was 13 or 12, we started her on the MTHFR. How tall is she? One of the tallest in the family now?
Yeah, she's taller than my 30-year-old sister.
Yeah, she's almost taller than me. So, and she's 14. Yeah. And that's what it does. And if I'd had all this stuff when I was in high school and in junior high and stuff, maybe I would have been 6'4". I mean, so, and wouldn't have these little corgi arms and legs I have. So a Tyrannosaurus, really more like Tyrannosaurus arms and legs. But yeah. So.
I relate to that.
Yeah, well, you're more corgi.
But he sent me to college with all these products, and I grew a little bit, which we thought I wasn't going to.
And she made straight A's at BYU Hawaii, where no one makes straight A's ever in the history of the school. Who would study when you're in Hawaii? But she did great, got a scholarship there and everything.
Thank you. Back to the questions though. So this is kind of a bulky question, but where can we do the testing? Would you have to do the testing like after a couple years, or is it kind of a one-time thing?
No, it's a one-time thing. No. Yeah, we send you the kit, you swab them, and we figure it out.
And so, how do we get the kit?
We mail it to you. You call us, or you order it. Go to the testing. Go to danperchmd.com. Go up to the testing section and order the kit. We'll fill out the information in it, get it ready. I showed you how to do it. Swab the cheeks, stick it back in the tube, put it in the silver envelope, shove it into the box, and mail it.
Cool.
And 10 days later, we'll have the results, and then we set it up. If there's a bazillion of you, are we going to still do that special? So, any of you that want to get the Pro 7 kit and get it looked at by me and us talk about it for 30 minutes, Brecken and Jackson have suggested I do a special. So I'm going to do it for $600. That includes the kit and 30 minutes of my time. And we'll limit it to the first 100 because if 1,000 of you sign up, it'll crush my soul. I'll never leave my office. I'll be there 20 hours a day for the next 3 years. So only for the first 100. And you can order that $600 deal. So you save $100. So plus you get a lot of great information that can change your life, change your child's life.
Exactly. Does genetics play into skin disorders like eczema?
I think so. I don't know. There's probably not a hard connection, but we don't know yet. I also think it definitely has a lot to do with fibromyalgia, which is not necessarily a skin condition, except for people with it. You can't touch your skin or they go crazy because of pain. But I just met with another physician this morning. We're really gonna do the big study on fibromyalgia to prove the copper metallothionein dysfunction, and we're gonna try and get it published in JAMA or New England Journal of Medicine or somewhere we're really serious about getting that data out there. If it's the last thing we do before we leave this earth, it'll always be remembered. It'll be a big deal and save a lot of agony and pain for people. So I'm really committed to that. But yeah, fibromyalgia, because you talk to a 30-year-old and she goes, yeah, my sister has it, my mom has it, my grandma has it. So we all have it one way or another.
Will genetic testing help with stomach issues, anxiety, and difficulty losing weight?
Yeah, it helps a lot with all three of those. Stomach issues, especially, I get a lot of severe B12 deficiencies caused by Mthfr and lack of taking the right kind of B12. And they get a pernicious anemia. I call it pernicious anemia constellation of symptoms. One of it is major gut and stomach problems, idiopathic gastropathy, things like that. They cannot literally digest food. And so you have to give them injectable B12 usually for months. And slowly but surely changes. And these are really thin, skeletal looking people. And their weight comes up, they start absorbing food better, and they get rid of their gut problems. Welcome to severe B12 deficiency, also called pernicious anemia. And they weren't even anemic. They just had intrinsic factor issues with their lack of B12. It makes me sad.
Yeah. Can Mthfr be reversed?
No. It can be, how do I say this? Undone. But the genetic error is always going to be there. There's workarounds that can take you around the problem, so you don't have the low testosterone, you don't have the low energy, you don't have the mental fog, brain fog, you have mental clarity, you have lots of energy. There's a lot you can do to work around it. And if you have all that and you're kind of barely functioning, get your genetics tested or at least try something for it. Mthfr Sport or Sport Plus or something. These are available on Amazon. Try it. Or try Super B if you're an unlimited distributor. I mean, when I say try it. You start with 1 a day, and then after a week, try 2 a day. After another week, try 3 a day. As long as you don't over-methylate, keep going up, you'll know how good you feel. So.
Sorry, I have a good question. With that question, someone was asking, can you try the Mthfr pills without being tested?
Yeah, sure. Yeah.
Cool.
Then if you feel amazing on them, I'd probably get tested. So, or just keep taking it. Either way, save your pennies up. And when you can't get tested, get tested. Because if you feel good on these, what else could you feel even better on? So you don't know. You've never felt this good. Genetically, you've never been there. So you don't know how good you can get because you've never been optimized.
Yeah. Do ADHD kids with genetic issues have a hope to get off meds with proper supportion?
Yeah, that's why we developed Tiny Bite. Yeah, I know what you're saying. So sorry, Brecken. If they have ADHD, find out if they have MTHFR. Find out their genetics, and then you probably treat them with Tiny Bite or half a Tiny Bite or a fourth of a Tiny Bite, and see how they do. That's what I do. So you'll know really quickly.
So we're getting a lot of questions about what is a Spectre cell and what's a Pro7 test.
Pro7 test is this genetic test. Swab your mouth. It's a genetic. Spectre cell is an intracellular micronutrient panel by a company called Spectre Cell Laboratories. They're in Houston. These guys are in Austin. I know it's confusing, but one begins with H, one begins with an A. And Spectre Cell looks at intracellular vitamins, minerals, amino acid levels, 39 of them. We used it at USC in research and stuff. It's a great test. I love it. It explains so much when you see it. Like if you have a child with miserable fatigue, I'd get that, and I would get genetic testing. You're looking at about $1,000 for all of it. Really, for that kind of testing, you can save your child's life, future history, and make them feel great. It's worth it. It's better than a trip to Disneyland. Oh, I didn't say that. Sorry. Maybe it's not better than a trip to Disneyland, but I don't know. I actually think it is probably better. Or a trip, maybe not a trip to Disney World, but better than Disneyland.
So is there a test out of those two that you recommend more for...
Situation.
But starting for inflammation, like looking...
Yeah, the genetic testing. Yes. Otherwise, you don't know what you're dealing with. Inflammation is a whole other issue.
Gotcha. And I'm just going to answer a question really quick because I'm in the office. So if you've already had these tests mailed in and you are in the process of us getting back to you, once we receive the results, we'll reach out by phone to call you and say, hey, your results are in. Would you like us to send you an email or would you like us to mail you a copy? And then we'll do that and we'll set you up with a consultation. And then you'll just be able to talk with Dr. Purser and figure out what your protocol should be. So that's the answer to that. And he loves that.
What's our MTHFR book at right now? Download your book. If you haven't downloaded it, go download it on Amazon. It's almost free. Okay, almost isn't free, but it's as free as they'll let us make it right now. 99 cents. That's pretty dang free. So you can basically, for 3 cents a day for the next month, enjoy this great book on Kindle. Okay, yeah.
And people are wondering, will this kit test for MTHFR?
Yes, it tests for all kinds of methylation errors. Yeah. Watch the video. You'll see exactly what we used in with those two kids on those two babies, the newborn and the 1-year-old. So it tests for MTHFR and several other methylation errors. I think 9 or 12 of them or whatever. So it really finds them all out. And I have had people light up on all of them. I've had them where their methylation is probably 1% or 2% of normal. And they're so fatigued and exhausted. It's like, how did you get to 45? How did you make it to 53? You are one tough hombre. So, because they feel horrible. They just march forward. The other risk you get is having a high homocysteine error. High homocysteine levels, death. It can cause a stroke or heart attack at a young age. 12, 14, 18, 20, 23, 25. You can have a stroke. If you know someone in your family that's had a stroke at 31 or 35 or 23 or 40, you need to think homocystinemia. And that's MTHFR or some other methylation error. Okay, sorry.
No, that's great. Would you recommend this genetic test for children with ADHD?
Definitely. Oh, yeah. That's kind of what it's designed for, mainly. You catch them now. Because there's a lot of natural options. Say Tiny Bites. a lot of natural options or liquid B12 drops from Pure that can really help them. There's also liquid 5-MTHF and other things. There's so many options now. Go look around Amazon. It's all being designed for you and your child or your grandchild or your husband who's been giving you problems for years and you just want to whack him.
We're kind of wrapping up, but we've had a couple international people ask about testing. I don't believe at this time.
Yeah.
GX you can, but not SpectraCell, right?
Right, not SpectraCell, but you can definitely get genetically testing. Because all you got to do is get it back to me or to the GX Science, who runs my genetic testing, within 3 weeks after you swab. So if you use DHL or FedEx or something like that, it can easily get there. I didn't mean to say that. Even the U.S. Postal Service could probably get it there in 3 weeks. I don't know if I trust that, but yeah, so you'd know.
People are wondering if you've seen lots of people with no MTHFR but have symptoms of it.
Yeah, they have other methylation errors. Big, bad, ugly ones like DHFR, MTHFD1, MTHFS, TCN, TCN1, TCN2, just a ton of them they could have. SLC 19A1, that's another one. Yeah, and if you're wondering if you have all the symptoms and you've been tested but it didn't show up. So if you haven't downloaded the book, please do. Leave a review if you can. Make sure you ask a question. I'll try and answer them all over the next 4 or 5 days. I'll stay on it. Night and day, sleepless. I'll be haggard by Monday, which you guys will think is funny, but I'll still be haggard. And then I'm going to take a few days off, but I want to answer all your questions. And this is really the future. I think psychiatrists are going to go more and more to this as time goes by. And if you think I can help, please get involved and help. I'm here. I love all you fine people, and I really appreciate your time. And let me help however I can. And Mike Clark will, if we get overwhelmed, Mike Clark is more than happy to help with these too. And so you may choose to use Mike Clark as your counselor on these issues. That's fine. You can go with Mike, and I can help too a little bit. I'm more than happy to. So let me know how we can help you, and we'll post this up as a video too, won't we? Mm-hmm. So I love you all. Thanks for your help, and God bless, and go in good health.
I'm gonna say something really quick.
Okay.
With the special for ordering the GX kit and getting the consultation price, I think the easiest way for us to track and make sure that you're getting this special is if you contact us through the office by calling our phone number, which we're going to post, as well as our email. That way we're just making sure that you're not getting missed or not losing out on the special. So if you're interested in that, just make sure you send us an email or give us a phone call. And we think that will be the best way to help everyone.
I like it.
And on top of that, someone else asked, are these coming more often or are they just getting unnoticed? And this summer, we're really hoping to push a bunch of these Facebook Lives out just so that we can be giving information that Dr. Purser is always researching and learning and is excited about sharing. So
I've been asked to speak all around the country. I just don't have time for it. My practice is full every day. I'm getting just toasted every day. It's getting really stressful, but I'll need a vacation eventually. But so I love doing these because I can reach out to you guys and help you. And it helps me get more patients, helps me help more people. We're directly successful in this life according to the number of people we help. I want to help a lot of you. We're also always working on new young living products and stuff like that. So working with you, helping you gives me more ideas. Plus, you give me a lot of input. We're calling this the Summer of Education Fund. Our next one's on the 29th, which is on PMS and endometriosis. And then we have another one 2 weeks after that, another one 2 weeks after that. Sometimes they're 3 weeks apart, but usually they're 2 weeks apart. We're going to end by the end of August. We'll be done with them. So we're going to do one on fibromyalgia. We're going to do one on male sexuality, testosterone levels, stuff like that. We'll do one on women's testosterone levels, testosterone issues. Just a lot of fun Facebook Lives. So, and we can't wait. So if you have questions more, kind of keep in touch. You can ask me anything, anytime. I'll try and get to them. I think there's like 17 places for you to hide comments and questions on my Facebook site. I try and ferret them all out. It gets really old looking sometimes. You guys can hide them all kinds of fun places. Helps to find the most recent post. That's where you post the question. And so I'll look there, and I'll look at the post I did today for questions over the next 4 or 5 days. But you can private message me. I'll respond. And I really appreciate you keeping in touch with me. Let me know, hey, it's free for me to respond. Sometimes I may go, I don't have a clue what's going on. Get the genetic testing or get a spectroscope kit, or ask your doctor to do this or that and help me with this. And I can maybe help them figure it out. So I love you all. God bless again, and go in good health, okay? Bye.